You've been diagnosed with cataract. Now what? For some of you, it's fear. For some others, it's panic. For some other people, they begin to ask questions from their friends, neighbor, uncle, auntie, that auntie that knows another big auntie that had surgery 15 years ago. As an eye nurse with 10 plus years of experience, I've seen people diagnosed with cataracts delay decisions because they are very afraid, or they are in denial, or take decisions that jeopardize their vision. And after all said and done, they eventually seek help. But at that point in time, it's too late. And I don't want that to be you. That is why today we are discussing seven mistakes people make when they are diagnosed with cataracts. Esther Eguche is my name. I'm a registered nurse, registered eye nurse, over 14 years of nursing experience. I'm also a certified fruit and herbal therapist. One mistake I see a lot of people make when they are diagnosed with cataract surgery is that they begin to spread their diagnosis in a bid to get clarity. So they tell their pastor, the elder in church that they are friends with, their colleague in the office, their neighbor, a friend, somebody that had surgery, somebody that knows somebody that knows somebody that had surgery. And with each telling comes various opinion, various stories. Some are exaggerated, some are founded on lies, some are founded on hearsay. By the time you gather all those experiences together, you become very afraid. The last thing you want to do is to have surgery because everybody is telling you different things. Get me right. I'm not saying it's bad to talk to people about your diagnosis or seek other people's opinion. But one thing you must remember is that no two persons' eye experience is the same. Because somebody can have cataract surgery and they could have underlying conditions like diabetes, hypertension, or they could even have glaucoma. So their outcome will not be the same with somebody who do not have any underlying condition. That is why you should never take advice about your eye health from somebody who is not a professional. The best person to ask questions and get clarity from is your ophthalmologist. If you are in doubt about what your ophthalmologist have told you, I would advise you to go to another eye hospital, go to another ophthalmologist and get a second opinion. You are allowed to have a second opinion. You can now form a decision. When they are told that their cataract is early or premature, they are like, oh, thank God, it's not serious. In a couple of months, if you are not careful about some actions you take following that diagnosis of an early or premature cataract, that same ophthalmologist will tell you that you need to have a cataract surgery. Do you know that there are some things you can do on a daily basis to protect your vision from some of the causes and triggers of cataract, like oxidative stress, poor eating habits, poor daily habits can speed up the progression of cataract formation. Find out some of these things in my book, Supportive Remedies for Glaucoma. Keep your follow-up appointments to pay attention to changes in your vision. Not every vision change might be as a result of cataract. It might be as a result of underlying disease conditions, something going on in your eyes, environmental factors. So every changes you notice in your eye should be checked out in the eye hospital. Protect your eyes from accidents. Don't be that person who there's an ongoing neighborhood fight, there is people gathering and you are peeping. You've been diagnosed with underlying conditions like a compromised gut health, ulcer, gastritis, gastroesophageal reflux disease, diabetes, hypertension, asthma, other respiratory conditions. Ensure these conditions are properly managed because they can also increase the progression of a diagnosis of cataract, despite the fact that it's premature or early. I've seen patients who come from neighboring countries, a distant state, to come and see a specialist. Long hours, wait 5 hours or even more. Get into the consulting room, they do all the routine, the vision is dilated, the ophthalmologist examine the front, the back of their eye under the slit lamp. As he communicates with the patient, do you understand what I'm saying? Madam, do you understand? Oga, do you understand? The patient keep nodding their head. And do you have any question? The client said they don't have any question. Just for the client to step out of the consulting room, and you are probably taking the folder or leading the client to the next place he or she is supposed to go, and you hear nurse. I don't understand what the ophthalmologist said. And you're like, what do you mean? But you nodded your head. He or she asked if you had any question, and you said no, you didn't have question. So some of those people may not even tell the nurse that they are not clear. They go home, they start using ChatGPT, using Google to research. By the time they are done with all those researching, fear creeps in, denial sets in, or they are more confused than they were before they even went in to see the ophthalmologist. So I'm going to share with you some questions you need to ask your ophthalmologist if he or she tells you that you have cataract, to help you get clarity. So the first is, how advanced is my cataract? The second is the cataract the only reason my vision is poor? The third is, do I need surgery now? If not now, what changes should make me come back? What are the signs and symptoms I will see in my eye that should make me know that, oh, this cataract is matured, I need to come back to the hospital, I need to have surgery now? What happens if I wait? What are the possible risks and benefits of surgery in my case? Having looked at the front and the back of my eyes, and you've asked me to do a number of tests, what are the risks of waiting if I don't have the money for the surgery now? Do I have other eye conditions that could affect my vision after surgery? These are very, very important questions you need to ask your ophthalmologist. At this point in time, it's very important for me to ask you to hit the subscribe button, share this video, like. If you have any questions so far, please drop them in the comment section, and I promise I'm going to respond to your question. And if your question requires an entire video, I promise I will make it for you. But please, you need to hit the subscribe button, like, share, so that other people who have been diagnosed with cataract can see this video and make informed choices that protect their vision rather than damage or predispose them to vision loss. There is no price for leaving the clinic with unanswered question. It doesn't make sense that you've paid for consultation, you've waited long hours to see the ophthalmologist, and you're leaving home, leaving the clinic without clarity, waiting until you can barely see before considering surgery. A lot of people, especially in West Africa, wait until they can barely see before they now present to have surgery. Do you know that the longer you wait, especially when your cataract is matured, can predispose you to complications during surgery? There is what is called hypermatured cataract. It can make the lens more difficult for biologists to remove. It can also increase your eye pressure, lead to lens-related inflammation, affecting the surrounding structures. Because of this complication, your recovery will not be as swift and smooth as somebody who underwent cataract surgery exactly when they should. So waiting until you can no longer see with that eye because of cataract is not a good idea, okay? Affects the quality of your life. You might need to depend on other people to be able to carry out some activities of daily living. It affects the quality of your work. You can make mistakes, and then the other eye is now doing, I need to stop driving. You might need to stop carrying out some tasks. You might be bumping into objects. You can even injure yourself. And you are putting extra strain on the eye that is good, and you don't want to do that. So it's important that as soon as you can, please go and have a cataract. Another mistake I see a lot of patients making is that they assume every blur vision, every vision changes after they've been diagnosed with cataract is due to cataract. It's not always true. Vision changes can occur as a result of retinopathy, optic nerve damages. It can be due to glaucoma. When you observe vision changes in your eye, please go and have it checked out. Don't assume it's due to cataract. It can save you irreversible vision loss. Because when it has to do with eye, time is king. They try everything just to avoid surgery. They go online, TikTok, any of the social media platform, and somebody is saying cola in water and use it as an eye drop in your eye is going to clear your lens, is going to dissolve the cataract, and you are putting. Somebody else is telling you put beetroot and cucumber, and they try all manner of things just to avoid surgery. The ones they are taking, the ones they apply on the eyes, the one they rub around on the eye, that is very dangerous. Right now, there is no cure, whether herbal, for a matured cataract. The only thing you are supposed to do is to replace that your natural lens with an artificial lens, which is a surgical thing. Don't just use unprescribed. Like, I don't understand. Anything that goes wrong with your vision it goes one way, which is blindness. So you don't want to be experimenting with your eye. You might not recover from the consequences. It might be something you regret for the rest of your life. So don't just be putting things in your eyes just because somebody said they did the same thing and it turned out well for them. Be careful. Next mistake I've seen a number of people who have been diagnosed with cataracts make is that they believe that after the cataract surgery, they will have perfect vision. According to the World Health Organization, cataract is the leading cause of avoidable blindness. So when you have cataract surgery, it's expected that your vision or the signs and symptoms you were having prior to cataract surgery improve. But there are a number of factors that can affect the outcome following cataract surgery. Number one is what I already mentioned earlier. If you wait too long to have the cataract surgery, complications can affect the outcome, the prognosis following surgery. The second thing is underlying eye conditions. Things like retinopathy, glaucoma can affect the outcome of your surgery. Underlying health conditions like diabetes, hypertension can affect the outcome of surgery. Cataract surgery. Discuss the outcome. Let your ophthalmologist tell you the prognosis. Know what to expect after the surgery rather than experiencing a form of disappointment following the surgery. To the end of the video. So we've talked about 7 mistakes that a number of people make following diagnosis of cataract, and I've shared my experience with you as an eye nurse, a registered nurse, over 14 years of experience, and a certified fruit and herbal therapist. Always make informed decision, and I've already exposed you to various ways you can make informed decision. Do not experiment with your eyes. Very, very important. Okay? And know the expectations. Always find out what will be the outcome. You can even ask your ophthalmologist to run the procedure. How is this cataract surgery done? What type of cataract surgery will I be having? So that you manage your expectations, you know your outcome, and you can have peace. And don't forget to pray about your surgery. Pray for your ophthalmologist. Pray for yourself. Pray for your recovery. Is very, very important. And I'll be back with another Save Your Eye series so that you can have knowledge and make informed decisions that protect your eyes. Have you hit the subscribe button yet? You don't want to miss the next one, I know. So hit the subscribe button, leave a comment. Have you ever made any of those mistakes before concerning a diagnosis of cataract? Or do you know somebody who makes some of this mistake? Please share your experience in the comment section. Do you have questions concerning everything I've shared so far? Please drop them in the comment section and I promise to respond to them. Till the next time, please protect your eyes. The optic nerve guard powder is made up of 7 herbal ingredients formulated to protect and nourish the optic nerve, regulate intraocular pressure, improve sharper and clearer vision, and improve circulation to your eyes.